Um, the next project is from the Dykens group at Vanderbilt University. This is a highly experienced group, have done just a ton of PWS research, and they recognize, as many of us do, that the hyperphagia measures that are currently used in PWS clinical trials, while they are important and they have proven useful, there's a lot of room for improvement as well. And particularly the FDA is very interested in, the perspective of the person themselves and not so much the caregiver's perspective. So any measure that we can do that is based on the perception of the person that is receiving the drug is favored by the FDA. We know that the HQCT, the Hyperphagia Questionnaire for Clinical Trials, can be vulnerable to informant bias, meaning the caregiver, the caregiver's perspective. And again, the FDA is interested in having the perspective of the person who's receiving the therapy. So this is a difficult task in PWS. We all recognize that, but I think this group is so knowledgeable about PWS and sort of the personality of individuals with PWS that they are going to try to develop a self-report of hyperphagia for individuals with PWS. So we're excited about this, again, because of the focus on the perspective of the individual who is experiencing the hyperphagia. This method might circumvent the specific approach that they're using because they have such knowledge of PWS and some of the cognitive difficulties we see in PWS. They're going to adapt it to the challenges of asking a person with PWS about their, about their hunger levels. So it may offer a new approach to this challenging problem. And this is a very experienced group and probably the only one who, could really address this directly with the individuals with PWS.